Wait, private companies spend 17 times more on administrative costs than Medicare? What are private insurance companies spending on that Medicare is not? Does Medicare spend hundreds of millions of dollars on television advertisements like private insurance does? Does Medicare spend millions of dollars on stock buybacks to shareholders?
No.
Does Medicare spend money on marketing? Private insurance likes to put its name on stadiums and PGA tournaments. Is there a Medicare arena?
No.
Does Medicare spend $23 million on executive pay like private insurance companies do?
No.
There isn't a lot of good news, but anytime Katie Porter gets to grill anyone on anything, it's typically exciting because she comes with the facts, she comes with the receipts. And in this context, she's specifically carrying out what we need to hear in Congress in regard to Medicare for all and how it would actually save not only Americans, but the US government quite a bit of money. It would be a far better system than the system that we currently have that relies mostly on private health insurance companies. Now, this was during a recent hearing that took place in the House, of course. And the whole point is to do this hearing on Medicare for all. The House Progressive Caucus wants to revive these discussions and these debates, which I think is a good thing to do, even though, let's keep it real, under this current administration, it's highly unlikely that we would get Medicare for all. But it's important to, I'd like to say keep momentum going, but momentum has died down a little bit. So trying to revive this, I think, is a good move. Now, Katie Porter came with the receipts, like I said, and she specifically wanted to draw this distinction between the costly, wasteful nature of private insurance versus Medicare, our Medicare system, and how it actually saves a lot of money. Let's watch.
Dr. Collins, what percentage of revenue do private insurance companies spend on administrative costs?
Between about 17 to 18% of spending in private insurance plans.
So if I pay my insurance company $100, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, $17 go to administrative costs. What about Medicare? What do they spend on administrative costs?
That range is about 3 to 5%.
3 to 5%. About 3 to 5%, right here. And if we look at just billing costs, just billing and insurance costs, Medicare's at 1%. We know how much it costs to run a high quality health insurance program. $1. Out of $100, research shows that Medicare spends 1.1% on administrative costs. We spend $4 trillion on healthcare every year. We could save $200 billion on administrative costs with Medicare for all.
Now, before I get into some facts, figures, numbers, and obviously applauding Katie Porter for always doing a good job in these hearings, I just want to note that there was a hearing on Medicare for all in the House. And any progressive who was touting the necessity of force the vote, who somehow failed to do any coverage on this story, is super sus, very suspect. Because this is something that deserves attention. Yes, the likelihood of this hearing resulting directly to Medicare for all and like the passage of it is unlikely, but that doesn't matter, right? The whole point of force the vote was it's spectacle, let's do spectacle. And everyone will, all of a sudden will get everything we want through spectacle. Yeah, okay, we know that that's not really the reality of the situation. But again, this is an important hearing. Crickets, I haven't seen any of the force the vote progressives talk about this hearing at all. Now, with that said, I wanna talk about what the reality is, add a little more meat to the argument that Katie Porter made there, because her point is exactly right. The system that we have in place right now is not cost effective. It's incredibly wasteful. The majority of the money that we see used by these private health insurance companies goes toward things like marketing, putting their names on arenas. I love the fact that she brought that up. But let's get into some other research. So there was obviously Kaiser Family Foundation does a lot of really great work on Medicare for all. They've been pushing for it, and they do so by presenting the data that people should know about. For instance, in 2020, the United States spent 19% of its GDP on health consumption, and every year it goes up. For instance, in 2019, it was 17%. Whereas the next highest comparable country, the United Kingdom, which actually has a much better healthcare system than us, devoted just 13% of its GDP to health spending, up from 10% in 2019. Now, of course, 2020 was the year the pandemic began, so you're going to see an increase in spending on healthcare as a result of that. But it doesn't matter what year we're talking about. The US always spends a higher portion of its GDP on its healthcare system compared to other OECD countries that tend to, by the way, have far better systems that cover more people and ensure that people are able to get the treatment and the care that they need, including incredibly important preventative care that prevents people from getting so sick that by the time they go to a doctor, by the time they go to an emergency room, whatever illness they're dealing with has unfortunately progressed to a point where they're going to need costly treatments and medical attention. Now, with that said, obviously, what Katie Porter and other progressives are touting here, Medicare for All, would be a far better system. And there's a reason why that system tends to be far more popular with voters. So we've talked about the polling. There are many polls showing that a single payer healthcare system, Medicare for All, would do really well with the electorate. Let me give you one of the more recent ones. We have polls dating back to 2018 and even earlier than that. But this one's from Pew Research in 2020, September of 2020. 63% of US adults say the government has the responsibility to provide healthcare coverage for all. And that was actually up slightly from the 59% in 2019. So I'm guessing experiencing a pandemic and seeing how faulty our healthcare system is made more Americans realize the necessity of something like Medicare for All. Roughly a third, 37% say it's not the responsibility of the federal government, according to the Pew Research Center survey. Now, there are Republicans, of course, who have been brainwashed into thinking that a single payer healthcare system is terrible. They've heard made up horror stories about Canada. They've heard made up horror stories about the UK, even though Americans travel to Canada just to get affordable prescription drugs. Okay, but what about something simple like a public option, right? I would want Medicare for all, but a public option polls even better. So 68% of voters support a public health insurance option, including 80% of Democrats and even 56% of Republicans.
I want to ask the audience a question. If you could raise your hand here, a show of hands of how many people get their insurance from work, private insurance right now. How many get it from private insurance? Okay, now of those, how many are willing to transition to what the senator says, a government-run system?